From UK, you are great to welcome Dr. Kash and Dr. Sumir. Welcome in Cairo.
Thank you very much. Thank you. You have been very kind. Thank you.
It's a pleasure to be here.
Me too, my brother. Now, what are you doing in Cairo?
Well, we are actually having British delegates with us who are on a hands-on clinical training course. And we have been at Dental Academy. We have been conducting the hands-on training courses in implantology and oral surgery for a while now. But we felt that during the training and teaching, we felt a huge gulf, a huge gap in their skills when we asked them to do the clinical training on models or sheepheads during our hands-on training. And when we asked them to transfer those skills to the patient, they have just gone, they just go panicky, you know. And we felt that need that there should be supervised clinical training courses which should happen in different countries, because we will learn, we as ourselves will learn from them as well. And this supervised clinical training is not a new concept. We in England, all our NHS trust hospitals, they have got junior doctors, they have got middle grade doctors, they have got consultants. So junior doctors are already treating patients under the clinical supervision of consultants. So it's not something which is new or daunting. So we felt that need, and we actually approached Prof. Shaban and yourself as well. And you were very kind, very welcoming to actually arrange this clinical training in university settings. And I think I will not want to stress over here about these key points. Supervised clinical training, which the delegates or the dentists are not left alone. They are individually supervised. And in a university setting. So where we have got the luxury of whole of the faculty behind us. So it's me and Sumir, not only me and Sumir. It's whole of the faculty which is behind us, supervising those delegates.
To support this.
And look at the learning horizon of these delegates, which means that they will learn from me, from Sumir, and whole of the faculty of that university. So I think this is an amazing opportunity and an amazing thing which we have come up. We never thought that this is going to actually go to that level, or the learning is going to be so huge. But the feedback from our delegates has been amazing. And don't forget, Cairo is on the wish list of every British. Every British citizen. They want to visit Cairo, and that's why Cairo hands-on course has taken up very well.
This is very good.
Yeah, I'd agree. The course is unique. It's not unique to bring students to Cairo to treat patients. That has been done before us as well. But I got involved a few years after Prof. Shaban and Kash had organized this course here. And what they have organized in this university setting with the social activities as well, and chances to go to Ain Sokhna, Giza, and things like that, it is unique. Now it's unique. We offer a unique experience for our students. And exactly as Kash said, it's not just myself and Kash instructing them and supervising them. You have Prof, you have the whole faculty, yourself and your colleagues giving a wealth of experience they have access to. And it is that makes it unique.
That's great. How both of you upgrade and develop that journey? You had a while you do training and come to Cairo and have this experience, clinical hand-on. How you develop this journey?
So I got involved after about 2 years. You've done it twice maybe before me, and then
it's about 4 years from now.
Yeah, so Kash and I, like we said, we work for private academies, providing implant training, certificate courses, postgraduate diploma courses in the UK. And those trainees, exactly as he said, struggle to get live hands-on cases in the UK. We're now starting to be able to provide that in the UK a bit more easily, but it's still a very restrictive environment in the UK because of regulations, medical legal. It's a very, very restrictive.
And it's patient consent as well.
Yeah.
So if you give the patient the kind of options of having treated in the standard clinics where the owner of or the employee of that clinic is going to treat, or you're going to be actually treated by a dentist who is on a postgraduate course.
Okay, so when I got involved with the course a few years after Prof and Cash had started it, I recognized the differences between what we were doing in the UK and what we were providing here. And some of them have a bit of a culture shock. Some of the trainees are not used to the differing standards in infection control, record keeping, which are all drummed into our training in the UK. So we have to manage their expectations, but also make them see the value in what they get out of this course, coming here and treating patients. So we're not here to learn infection control, we're not here to learn record keeping, but we are here to gain competence and confidence from clinical experience under supervision.
That's great.
I think it's a great opportunity because when the clinical exposure they get while placing implants, while doing the surgical procedure like incisions and flap retraction,
Suturing and
the clinical exposure they get, it's valuable, and that's the beneficial for them when they go back actually. And I think it has developed because of the feedback from delegates. As Sumir said, it's a huge cultural shock.
Yes, of course.
It's a huge culture. The moment you land in Cairo, it's a huge cultural shock. You know what I mean? Getting an Uber from the airport is a cultural shock. You know? so the delegates has to be prepared for that. And it's a learning experience as well, because we in England we're living in very protected bubble. With protected bubble of regulations and all of that. And when we come out and see the open world, then it's learning altogether. So I think it has developed very well over the period of years. Yes, we had challenges. Yes, we had weaknesses. But this is the all part of learning. And we are never complete. We are never going to be 100% or 101%. There's always a chance for improvement.
But your trainees have the opportunity to transfer this knowledge and this experience in UK. He can manage his own clinics.
Yes, so as I said, they're not going to go back and start using different materials or different
techniques,
regulations.
The same way.
They have to stick to the same regulations, infection control, radiation protection, record keeping. We keep that the same. That's not going to change. They are obliged to stick to the UK standards. But in terms of their confidence in assessing surgical confidence, like he's saying, raising flaps, suturing, that becomes exponential with their confidence and competence.
He can do implant by himself in his clinics.
Well, I mean, we still recommend that they have mentored cases when we go back. But what we know of them before we bring them here, and when we go and mentor them after they've been here, is a massive change in their confidence, their competence, their ability, their ability to discuss cases, the language when they're raising flaps, and it's completely new.
Look at the confidence level. One person who just lands in Cairo, haven't done an implant in whole of his life, and when they leave, they will have placed 10 implants. Under closed clinical supervision. When I have to literally hold him back. He goes beyond. So I have to hold him back. No, they're there for learning, you know. So it's very close supervision. And then once they do 10 implants, then they'll not be afraid of actually putting the blade onto the gum when they go back. That fear is taken away. Otherwise, most of us are afraid of these things, you know. And we all make mistakes. We all make mistakes. It's learning from those mistakes that's the key. And that actually is a very valuable learning.
Yeah, well, they not. I mean, we tell all the novices, brand new dentists, that the difference between a novice and an expert is that the experts have tried and failed more times than they've even tried. And it's our failures that make us experts, learning how to manage and cope with those failures.
How much the patient, how much the failures, how manage everything is the clinic.
So they shouldn't be scared to fail. The problem in the UK is a medical legal environment. It is such, the regulations is such, is that there's no room for failure. You make a mistake and your career could be at risk.
It's very changeable in UK.
It's very challenging.
Now, what we're planning in the next year and next course, how we can more develop, more experience we share with the trainees?
I think we are continuously evolving. Every time we do a course, I think there is a new sort of challenge or new sort of aspect bring about by the delegates' feedback.
Yes.
And then we have to address that aspect. So we are evolving all the time. one aspect which has been brought over again and again is the restoration that goes on top. So they want to learn about that restorative part as well, which is logistically very challenging because restoration is not one visit.
Yes.
So it has multiple visits which are going to have gaps in between. So them coming over here for that restoration is a challenge. Yeah, unless and until we are developing the to shorten that time frame. We are developing with the labs and technicians to shorten that time frame. And if that time frame is shortened, for example, they can come on Monday and by Friday everything is ready, and then they can actually have the restoration done. So that is one aspect we're working on. The other aspect is the advanced surgical knowledge and advanced implantology techniques or procedures like extramedullary implants, pterygoid implants, nasalis, and zygomatic implants. So we are actually developing a program with yourself and Prof. Shaban, if they can have that experience in a university setting again, which I think is the main part of our course.
Yes.
That we are more comfortable in a university setting.
Yes,
that has to be the case because we have to have that backing of yourself, people like yourself, Prof. Shaban, and all of the faculty.
Yes.
I mean, we have got literally 60 experienced people with us. So which is this experience cannot be gained anywhere else.
I think zygomatics is limited the numbers of people who will ever go back to the UK and start doing that. But I agree that the advanced surgical training, many of our trainees from our academies who have come here and gone and started placing implants routinely want to learn how to do some of the advanced things like lateral window sinus lifts, ridge splitting, block grafting, Corey plate type techniques, which
all on 6.
all on 4, all on 6 with immediate loading, like we were saying. And we had that discussion earlier about how can we get them here and within a week or 5 days like we do now, get the impressions done and the crowns. And we said maybe we can make the crowns in advance and hide them in our pocket and say, take the impressions for us. Here's a scan impression, try it in open try close tray, and then when they're not looking, we go, look, there's the crown.
Knowledge to have the experience to feel the impression and different techniques of impressions.
Absolutely. Yes. Because they're not going to be involved in lab stages anyway. That would be a year-long course if they have to make their own
crown. We can involve the scanners and digital dentistry and how the planning from the scratch to how to leverage the patient.
So the whole range of restoring, from single implants to bridges to trions to full arches. Exactly.
So it is very actually appealing that we are able to offer the opportunity to our delegates, not only these delegates, the previous cohort delegates. I mean, we have been doing minor surgery courses and implant courses since many years now. So all those delegates have now actually stepped ahead, stepped forward, and they are at another level to actually go to the next stage. And with expertise like yourself, we've got the whole of the MaxFax team at Al-Azhar, Prof. Shaban. I think it's going to be a great venture.
Yes,
going forward, I can see us developing more courses, not just the advanced surgery courses, but the restorative courses as well. We just make it easy for them. The main thing is we make it fun for them.
Yes,
some of the social stuff is going.
That's the only thing. That's fun. That's the only aspect of being Sumir for. Otherwise, you don't need it.
So everyone goes off to the Giza pyramids, everyone does a Nile cruise, everyone goes off to the museums. So everyone, like you said,
it's not about experience, or it's about fun too.
It's fun. It's stressful enough in the clinic. After we need to let us sleep.
No, it's amazing. I mean, I think the biggest challenge is not about placing in, but the biggest challenge for delegates is to get the sleep.
Yes,
because we actually after dinner we go for drinks, and then we finish it out. Then we discuss what has happened today, what have we learned, what was good, what
we do tomorrow.
What
the cases,
the cases.
Yes. And then 1 a.m. we go to our bed, and then 6 a.m. he actually poses a picture from the gym, telling them to come to the gym. You know what I mean? So I think the biggest challenge is for them to get the sleep.
That's great.
Yeah.
Now, the dentists in UK can come to Egypt and have experience, learn something new, have fun. What about if a dentist in Egypt, how he can work or have experience in UK? How he can do it.
No, we will welcome them with open arms, and there's quite a lot of opportunity in there for them to actually come, learn, work, and gain the knowledge. Now we at Dentab Academy are EduCall approved center, so we can actually issue level 7 diplomas.
Really?
Yeah. So yes, I'm not joking.
I can. No. So every dentist in Egypt have a dream to go to UK, but it is so hard. Too many years, too many papers work. I can afford to do learn again from the scratch. It's very hard.
I mean, that process has been simplified. There's no doubt that there is a shortage of dentists in the UK for the population to provide the government-based, the NHS, National Health Service dentistry. There is less and less dentists providing the low-cost dentistry, and they are short workforce. So we're training more students, so that university taking extra, but it's not touching the sides of the gap. So last year, I think 600 people were allowed to sit the overseas registration exam, which was an increase from 100 the year before. So it wasn't doubled. It went to 6. And this year, I think,
they're planning to even increase it more.
1,200 people will be able to sit it. So it's become easier to get an opportunity to sit the exam. The exam is not easier. So you have to prepare for the exam. So you will not be allowed to work in the UK or be registered with the UK if your knowledge or skills are not to the standard required.
That's true.
But the process and chances of
having
it's
more easier now.
Yeah.
But about the diploma,
so there are 3 aspects for an Egyptian dentist to actually work in UK. So first of all is learning. For that, we have got the platform of Dentab Academy where we can actually offer level 7 postgraduate diplomas. So they can actually come in, learn, and come back, and that's about it. The second is to be able to do the work. To do the work, they have to actually do the overseas registration exam. And for that, that's another aspect we can actually work with you, and we can actually establish a course to prepare them for overseas registration exam in here. So they don't have to. They don't have to come to England. We actually come. Sumir, myself, and other tutors can come, and they can actually teach the
them here before they do the exam.
Preparation exam here. Great, So that is the second aspect. The third aspect is they need to get a work permit. Now, me and Sumir fortunately share. We are owners of quite a lot of practices. So what we can do is we can actually help them in getting the work permit issues or visa issued, and we can actually fulfill those conditions.
You make it so easy, my friend.
It is because as Sumir said, we at NHS, we need dentists. In England at this point of time, nobody is going for NHS dentistry. So the best way is going to be for dentists like the Egyptian dentists can actually come over. They can fill that gap. And if that gap can be filled, then it is beneficial for the patient, because I've seen the standard of Egyptian dentistry is amazing. I mean, you guys know everything about everything. So, even your clinical lecturer is very knowledgeable. So that's the 3 aspects we can actually cover them. So they are more than welcome to come for just for the courses. We also run minor surgery courses. We do it at London, King's College London. So there is a modular program which we do it conduct in London, King's College London, and then we do courses from weekend courses to 1 week courses to 2 years courses. So it's a huge range.
Yes, it's a very huge range.
Yeah,
and about the preparation of the candidate here in
So
Egypt to the doctoral exam.
I've been an examiner for that for the overseas registration exam, but more. I've only done that a few times at the beginning, and since then I've been teaching people how to pass the exam. So training people to pass the exam. I've done that quite frequently.
How long will it take to prepare?
Maybe a 1 week course for the theory, maybe another week for all the practicals. And the main problem people have from overseas is the communication and consent. The English patients are very spoiled. We have to pander to them, but we respect their autonomy. The emphasis is always on co-diagnosis. So whatever you diagnose, you have to explain that to the patient so that they understand it. Then encode treatment planning. We give them all the options that are available to them.
Communication is very important with
Yes.
the dentist and the
The
patient.
risks,
Yes.
benefits, costs, the prognosis of each one, and actually shared decision making. It's important that the patient makes a decision whether they're going to have a crown or whether they're
To
going to have a
agree
bridge.
what you would do.
Absolutely.
Hmm.
It's an agreed treatment plan, exactly that.
Yes.
So
You
that
see it in
concept
the-
doesn't always exist outside of the UK, especially when you get to Asia and Canada.
Yes, we don't.
Here it's very still parental. The doctor is always right. What I say, that's what you're going to have.
Yes, we do.
Yeah. I think the clinical aspect, we can actually go for the ORE part 2 preparatory courses. And the clinical aspect, the Egyptian dentists may not be, I mean, we're not going to tell them how to cut the crown. They already know about that.
Yeah.
I think the gaps are, as Sumir has mentioned, communication skills and the consent. So that instead of they flying off to UK and paying the ticket, the hotel, getting the visa, it's much easier for them to actually attend this course in here. And that's
It's very, very good idea. And they have a lot of people think about it as a dream for dentists here in Egypt to travel to UK and work in UK.
Yeah.
But I think it's not about communication only, infection control.
Yeah. We've spoken to Prof. Shaban as well and the faculty of Al Azhar as well. So we may be thinking about the future collaboration as well. So that will happen pretty soon. So
Yes, I hope.
hopefully with your collaboration, with your kindness,
This is easy for me.
Yes. We will be able to launch these programs. Yeah.
I hope. It's nice to be with me today. I'm so proud to know both of you. I know Cash before you, someone in last year. Last year, February last year.
That's right.
It's my pleasure to meet you and talk to you together. You have a very, very good experience and have very beautiful personality. You are very welcome in Egypt.
No, thank you very much for your hospitality, for looking after us, and
for looking after the trainees.
Yeah.
When we get tired of their questions, we say, go.
I'm with you, man.
Yeah, we were so relaxed,
Once you're there, we can relax.
Thank you.
No, thank you very much for having us. Thank you very much.
Thank you.
Pleasure.
We are so proud now to introduce Prof. Dr. Ahmed Shaban to join us today.
Welcome, Dr. Shaban.
Everybody.
Welcome. How are you?
Hello, dear.
Hello, Dr. Ahmed.
Hello. Welcome again.
We're just
nice
talking
to be here.
about the course and how the trainees will have a lot of experience in the being here in Egypt and do the clinical hands-on. Can you share with us?
Usually I call it a program. It's program more than a course.
Yeah.
Because we do everything. We not only basic things, not only straight implants. We opt to make some modifications.
Like
some
what
cases.
can you do about the patients? How
Yeah.
to do?
Yeah, we make like a quick planning for the cases, maybe before the course, before the program. A proper planning between me and Professor Cash and Professor Sum, and we discuss in details what we are going to do. Sometimes we need to make some extra things to the cases away from the basic things, like, for example, bone augmentation for the fenestration cases. As we
Especially
always
the
do
medial
that.
case, especially in medial extraction.
We made a lot. We make a lot of medial implantation. Tons of extractions. Yeah. So sometimes, or most of times, you need to make some bone augmentation. Sometimes we make internal sinus lifting.
Yes.
Some cases we need to do that because the quality of bone lately for most of the population is very low. That's most of the things that we do it. In the beginning, it was not like that. The program was not like that. It was by myself for Egyptians.
Yes.
Only, or some Arabs, something like that. It was like 1 month.
For Gulf area.
Yeah, 1 month. It was 1 month.
Yes.
Very long time. A long story of lectures, all branches, orthodontics, radiology, surgery, even laser.
Yes.
And after that, they are going for the 10 cases also that we always do. We have the concept of 10 cases that can make a implantologist
Yes.
in the beginning of the way. The first step is to make at least 10 cases.
Yes.
That's the key. And after that, Kash noticed that I have that program for the Egyptian. He told me, why we don't do that.
Why are we in Britain? We're not getting the benefits.
Why
is it only for the Egyptians?
Yeah. In this time, yeah. He already have like an association like mine here, Smile Academy in I think in London. Yeah. And they have also the same practice there. They made it. They made lectures. They make some practical things. Preclinical, we call it preclinical casts, workshops and hands-on. And I think sometimes they make some cases, but they need to improve their candidates more. So he told me for that.
More clinical experience.
Yeah.
The volume was very slow. They couldn't do a high volume of cases in a short time. Some of them would leave the program. It took them so long.
Oh.
Yeah. This is the problem of most of the programs approved. They need more experience for their candidates, clinical experience.
Yes.
And they gain it. I think for our previous courses, I think now for 4 years.
If we wouldn't have gained it, we'd not have been here for 10th time.
10th time, maybe now 5 years. Well, for 5 years.
Yes. We had actually literally like in 10 times we have literally gone more than 70 delegates. 70
more than
70 delegates have actually
You remember, we've done this in Mexico.
Maybe more than 100.
Yeah.
Oh, really?
Yeah.
There you go.
Cash and I have done this in Mexico. We've done it in Pakistan as well. No one can deliver like this man.
Sure.
Sure.
Yes.
Delivery is the key. The last thing you want is you promise them 10 implants, and when you come here, they're not being offered 10 implants. I mean, this is the last thing you want. They have applied for the visa, they have taken time off, they have registered tickets, hotels, and we say, you know what? Sorry, we cannot deliver 10. That is.
Yeah. It's not only about the number. Sometimes you have 10 cases, but they are not suitable for you.
Selection of the cases. Selection of the
cases.
Selection of the cases.
Very important because we have a short time.
Yes.
They are only have 1 week here. Because they already have the other things in England, and they continue that compressed practical part in Egypt. So they only have maybe not 7 days, 6 days. So they need to be meticulous. All cases are suitable for them and ready, and make like reserve more cases. Just you are excluding.
Just in case.
Yeah, you may need to exclude some cases in the middle. If some reason,
sure.
You should do that. So that what makes us now for 5 years now continuing 2 batches per year. 2 batches per year in May and sometimes in April or February, the first half of the year, and the second half of the year in October mainly, like that we just finished.
Well, to be honest, it gives us the opportunity, at least me, the opportunity to learn from him as well, because all my training is like surgery, but prosthetic, I do not know anything about it. But whenever I
only cares about the prosthetic part.
Yes.
He's used this.
This is one of my concerns to be with them, because if you don't guide the practitioner, he may like. I will tell you a joke about one of my colleagues. He passed away. He was his name was Kostas. He was like Greek.
Yeah.
He told me he's a surgeon. I told him, how do you do that? How do you do implant like that? And you want me to make it
a crown?
Crown. He told me you are a surgeon. Whenever we find a bone, we put an implant.
It's yours.
So that's why I'm there for just controlling the situation from
the direction.
At least the minimum requirement.
Yes.
Not all. I will make it perfect. Minimum, at least, to make a suitable prosthesis for the patient.
Like some catches that craze in the ice cream. The ice cream.
It has to be the perfect situation. It's never going to be perfect, but Prof manages to turn it into a perfect ice cream. Exactly.
What about the next course in football?
Our next course from
February. 9th to 14th of February.
to 14 February. 6 days of
Valentine's Day.
practice.
Yeah,
When is Valentine's Day?
Celebrate the Valentine's
This
Day.
is Then you can receive the cases at the
I have
Valentine.
a large number of implants.
Yes.
A beautiful party.
We put
Yes.
more than 100
Oh,
each time. 100,
it's very
120.
good.
Yeah,
Number.
very huge number
With a very good experience.
for sure.
And
A lot of cases, yes.
And it's not only with the clinics finishes at 5. Now today he's taking us to Khan al Khalili, the
Yeah.
whole, you
A
know,
walking
it
tour.
is
Another
Because
duties.
Yeah.
it's a joy. It's a journey.
Yeah,
It's
Yes.
another
amazing.
duties.
Yeah.
Because you don't forget that they are coming also for joy.
Yes.
They're coming from a long way,
Yes.
not just for placing implants. They need to make
Yes.
some entertainment.
Some joy, yes.
he took us to a Nile cruise. Today we're going on a walking tour of old Cairo, Saint Mosque, Khan al Khalili. Tomorrow we're going to
He's a
Amsterdam.
historian
Yes,
as well.
it's-
Yeah.
Yeah.
Yeah. Yeah,
And
he-
they-
Only
they
about
always
the
say-
clinic and place.
Yeah. They need to, because entertainment is part of the journey. So not only for science. Science is good, but sometimes you need some modification
Too much stress.
to relieve the stress for the next day.
Yes.
Sometimes they maybe sleep at 1 o'clock after midnight,
Yeah.
2 o'clock, and I wake them 8 o'clock to be ready for the.
Not only at you wake up at 8 o'clock, he's 6 a.m. He posted a picture from the gym.
Yeah, I love to go to gym.
Family how they sleep.
Yeah. The first thing he asked about in any hotel going to stay.
Where's the gym?
With the gym.
Where's the gym?
We're all asking about the breakfast area. We ask about where's the gym and swimming pool.
No, it's been an amazing journey since we have started. We have evolved and we have developed. But thanks to Prof and thanks to yourself as well. So we're always welcome. So that's very good.
We always together to make something value to the trainees to for us also we learn from everything. We have help each other and
Yes.
have a value, add a value to anyone.
Yeah. I think
That's
it's
the
one of
value.
the biggest programs in the Middle East.
Yes,
I think
yes.
no other program with the same benefits and the same concentration. I think, and we are going to
For sure,
expand
for
more.
sure. Yes,
The
it's
next
for sure.
years we are going to expand it more. Maybe after the program ends, we will need to make like a diploma. Accredited from some universities in Egypt. They are offering us some like that.
This
To
would be
create,
great.
to create like a bigger program, to be a bigger program.
Bigger, more
6
bigger.
months, 1 year, and have like official certificate from
But
university.
it must be there in 6 months or be like with the
It
clinical
will be
way.
discussed. They offering us some universities offering us that
We can some lecture remotely and another would be there.
we can do that.
visit.
To facilitate for the candidates.
Yes.
Not to be here all the time. We will discuss that for the non-Egyptians. For Egyptians, it's okay. The problem is for non-Egyptians for traveling, so we can find a solution.
Very long.
Yeah.
I think we can add the value another.
Yeah.
To it,
Very added value for the courses in Egypt. Because I think it's a new type of practicing.
Yes.
Under pressure, many cases, short time, that make him a very professional.
Yes.
Working under pressure, as I told you, short time, 10 implants, he needs to make them.
In time.
You know what I mean?
Yes, in
Just
time.
that
It's
time, each day he should finish at
Because a
least
day,
3 implants.
Come back. No come
Not
back.
only
No
the
come
time, not only the time, Sumir shouting at them as well.
All the time.
Well, the boat is going to leave. The Nile cruise is going to give new fun.
Yes.
I can't waiting to see you again in February.
Yeah.
And I think we can do a podcast together
Yes.
again.
Yeah, for sure.
Inshallah.
Inshallah.
See you soon, my friends.
Thank you very much.
Thank you.
Thank you.
Thank you.